Welcome to Lesson 21, entitled Qualification and Validation. The following are the objectives or the learning outcomes of this lesson. We'll talk through validation, just give a brief introduction or background on what validation is, and the relationship between validation and qualification. We look at the scope of validation. We'll talk through qualification and the documentation around these processes. We'll look at the qualification process flow. I'll discuss or define what requalification and revalidation is, as well as periodic revalidation, and just briefly mention the need for revalidation after change. So validation is an essential part of GMP and an element of quality assurance. It also forms part of regulatory requirements, and the basic principles include safety, quality and efficacy of products built into the product, as it can't be inspected or tested into a product after the fact, and all critical steps in the process needs to be validated. The need for confidence that the product will consistently meet predetermined specifications is important, and documents associated with validation include things like standard operation procedures, specifications, a validation master plan or VMP, qualification protocols and qualification reports, as along with validation protocols and validation reports. So qualification and validation, and how are they actually tied in together. So qualification and validation are essentially components of the same concept, really. The term qualification is normally used for equipment, utilities and systems, and the term validation is normally used for processes. So in this sense, qualification is considered to be part of validation. And validation refers to the total life cycle of a product, from the development of the product through to its use and maintenance. And owners are responsible for validating their own processes, whether they be equipment or methods or procedures. They validate them to ensure their compliance with CGMP and GLP procedures or requirements. Qualification is a part of the validation process which verifies modules and system functions prior to being placed online, and therefore according to a standard operating procedure. So you need to qualify your HPLC system before you can validate your method on the HPLC system. So validation is an act of proving, in accordance with GMP, that any procedure, any process, any piece of equipment, material, activity, or system actually leads to the expected results. And qualification, it's an act of proving that any premises, any system, or any items of equipment work correctly and actually lead to the expected result. And the stages involved in qualification of any of the aforementioned, like systems, utilities, or equipment, require DQ, IQ, OQ, and PQ, and I'll delve into them further in the next couple of slides. So the scope of validation, there is basically two basic approaches to validation. The first being evidence obtained through testing, and that's normally considered prospective and concurrent validation. And then the second approach is through analysis of accumulated or historical data, which is considered to be retrospective validation. So normally, where possible, prospective validation is preferred, and retrospective validation is not really encouraged any longer. And it's definitely not applicable for sterile products. Retrospective validation isn't allowed for sterile production for obvious reasons. Validation requires an appropriate and sufficient infrastructure, including organization, documentation, personnel and finances. Validation requires involvement of management and of QA personnel. It involves personnel with appropriate qualifications and experience. Extensive preparation and planning is needed before validation is performed, so you need the right personnel. A specific program for validation activities must be in place, so this is your validation master plan or your validation schedule. And validation must be done in a structured way according to documentation, including procedures and protocols. So there must be, it's a structured activity. So validation should be performed for new premises, if a new premises is being built, for any new piece of equipment that's bought, as well as any new systems or utilities in use, as well as processes and procedures. All your procedures in the lab, for example, must be validated. Validation has to occur at periodic intervals or when major changes have been made. So if a piece of equipment is swapped out, that's not like for like. You should revalidate your process or revalidate your method. on a case-by-case basis. A written report on the outcome needs to be produced following your validation. So you must validate over a period of time, and normally for production, we would validate at least 3 consecutive batches on their full-scale production batches to demonstrate consistency of the manufacturing process. You must demonstrate suitability for new manufacturing formula or method. Process materials and equipment need to be validated to prove consistent yield of a product to the required quality. If there are significant changes to the facility, to the equipment, or to the manufacturing process, then that needs to be validated. And finally, risk assessment approach used to determine the scope and extent of validation is needed. So before you begin your validation, you do a risk assessment to see what aspects need to be validated. So qualification, again, we talk about qualifying equipment or process or utilities or systems. It should be completed before process validation is performed. A logical systematic process needs to be followed. You start from the DQ phase, which is the design qualification phase. So you design your premises, or you design what type of equipment or utilities you want. Major equipment and critical utilities and systems normally require IQ, OQ, and PQ. IQ being installation qualification, operation qualification, and finally performance qualification. So some equipment, utilities and systems require only IQ and OQ, as the correct operation should be considered to be a sufficient indicator of its performance. So for example, a balance, you might do the DQ and the IQ and the OQ. So the operational qualification will give you enough information to eliminate the need to do a PQ, because your PQ will be your routine performance or the routine use of that balance. The equipment, utilities and systems should then be maintained, monitored and calibrated according to a regular schedule. So every piece of equipment, every utility or system needs to have a regular and routine maintenance or calibration carried out on it and documented. So what are the different types of documents associated with validation and with qualification? So the first thing we talk about is a validation master plan. And your VMP, or your validation master plan, contains key elements of the validation program or the schedule. It should be clear, concise, and it should contain at least your validation policy along with the organizational structure of the validational activities. It should have a summary of all your facilities, your systems, your equipments, and your processes validated and to be validated. So again, it's a living document. It should have plannings and schedules listed in the VMP, and all change controls and references to documents should exist within the VMP or the validation master plan. Your validation protocols then, qualification and validation protocols need to describe the study that's going to be performed. And within that protocol, it should list the objectives of the study, along with the site that the study is being performed at, the responsible personnel carrying out the validation or the qualification, the description of any SOPs that are going to be followed, a list of all the equipment that's going to be used during the validation or qualification, the standards and their criteria for the products and the processes, along with the types of validation or qualification that's being carried out. So you include all your information up front in your protocols. You should have sampling and testing requirements, and of course predetermined acceptance criteria should be included within your protocol, along with a description of how your results will be analysed. That protocol needs prior approval before you launch into your validation or your qualification, and prior approval is normally given by the Quality Assurance Department. Your validation reports then for both qualification and validation activities are written reports on the actual qualifications and validations that was performed. It reflects the protocol follow-ups and includes things like the results that are or have been evaluated and analysed are compared against the predetermined criteria that were set out in the protocol. Of course, it should have a title and objective of the study that matches the protocol. It should list all the equipment that was used, procedures and test methods. So the results that were generated during the validation or the qualification should be listed within the report, and those results should meet the acceptance criteria that were predetermined in the protocol. Any deviations or outer limit results should be investigated, and if these were accepted, this should be justified. And where further studies or testing was carried out, they should also be included within the reports. Responsible departments and QA need to approve the reports and include any recommendations or conclusions. And finally, standard operating procedures speak for themselves. And what should a validation document include? It should clearly define responsibilities for performing the validation. It should be conducted in accordance with predefined, approved validation protocol. Validation reports should contain recorded results and conclusions, and processes and procedures should be established on the basis of the results obtained in your validation report. So to look at the qualification process a little bit further, it's split into 5 different sections, and we'll just walk quickly through each section. The first one being design qualification. So this defines the functional and operational specification of the piece of equipment. So if you're buying something for the lab, your DQ explains what you're going to use it for, and the specifications around the operations, around the operation of that piece of kit. The installation qualification then is carried out once your equipment comes on site, and it's documented evidence to prove that the supporting utilities or the equipment or even the premises have been built and installed in accordance with the DQ and they meet all GMP requirements. The OQ then is evidence to prove that again the premises, the utilities or the equipment operates in accordance with their design specifications, which were listed up front. And the performance qualification shows that the system or the piece of equipment performs consistently in accordance with their DQ. So PQ normally involves repeating several different tests over several different days to make sure we get consistent results. And finally, the maintenance qualification describes and documents any maintenance required on the equipment going forward. So the process flow then for qualification of a piece of equipment would be to look at your validation master plan, or make sure that that piece of equipment is listed within the validation master plan. You generate a user requirement spec or URS, which you then go out to your approved vendors to select which one you'll use for purchasing the piece of kit. It's delivered on site and installed. The IQ is carried out, it's configured correctly. You then write an operational qualification plan, and it's then subsequently, which is pre-approved, it's executed then to make sure that it passes its requirements and it meets the DQ. You write a PQ plan, which is a performance qualification plan, that's executed and tested, approved, and then you generate a usage, maintenance and calibration schedule for the equipment. So requalification then, in accordance with every piece of equipment must be requalified in accordance with a defined schedule, and the frequency to be determined on a case-by-case basis. For example, on the basis of factors such as the analysis of results relating to calibrations, verifications, and maintenance. So each piece of kit would have a different recalibration or requalification frequency. Requalifications should be periodic and after changes. So if there's been a change to your utility or your system or your equipment, or maintenance work carried out, then you should be requalified, and requalification should fall under the remit of your change control procedure. So it needs to be pre-approved through change control and monitored throughout and closed out at the end. So we talk about revalidation. So processes or procedures need to be revalidated to ensure that they remain capable of achieving the intended results. Very much like requalification, you need to have periodic revalidation, as well as considering a revalidation after any change has been made. Again, it needs to be carried out in accordance with a defined schedule. The frequency and extent determined using a risk-based approach, along with historical data or concrete evidence that revalidation is warranted. So to assess, periodic revalidation is normally carried out to assess process changes that may occur gradually over a period of time or because of wear and tear to a piece of equipment. Consideration is given to the master formula and specifications along with SOPs, records, for example, calibration and maintenance, and the analytical method as well would be another consideration when looking at the revalidation of a process. So revalidation after change. After change that could have an effect on the process or the procedure or the quality of the product or the product characteristics, then you need to look at revalidation. So that's normally falls under the remit of change control also. The extent of the revalidation depends on the nature and the significance of the change. Changes should not adversely affect product quality or process characteristics. Changes of equipment which involve the replacement of equipment on a like-for-like basis would not normally require a revalidation. For example, installation of a new centrifugal pump to replace an older model would not necessarily require revalidation in the production area. That was a very brief overview of change control, and that's the last slide. Thanks for listening.